Recording in
Welcome in, everyone. Welcome to Care Concierge with Carepatrol, where education is the heart of everything that we do. We're so happy for you to join us today. I'm posting information in the chat room for you now about today's link and today's topic, which was suggested by a former attendee of one of our CEU courses, is the section 1915C HCBS waiver. And you will have the opportunity to suggest topics that you'd like to see presented if you complete our evaluation today, which you must do in order to receive credit for this class. If you're new to Care Concierge or Carepatrol, we are a aging care navigation service. And what that means is we're a placement service. We help people find wherever home is for them, whether that's in their residence that they've been in for some time, or if it's a new community placement, we work with them at no charge. We drive folks around like a realtor to properties that we think they'll be interested in because they match their budget or other parameters. And if they choose one of those properties, or if they choose a sitter service that we recommend, we're paid by that provider. But it doesn't limit us to what we look for. We look for home health and hospice and nursing home and rehab services, all of which are prohibited from paying us. And we also help people find communities that we may not even be contracted with, because that's the right thing to do. And the thing that we do all along the way, if we can, is educate our clients about what's next, what things mean, what to expect, how to pay for things, and how to get those benefits. That's what we do, and it allows us to do this with you, which is also free, which is to provide these contact hours. And it is something that I very much enjoy. We encourage discussion, as many of you know, so I'd like to start with a topic that's appropriate to Carepatrol, which is right now there are over 35,695 family caregivers currently employed. There's the key in the United States. What percentage are women? So of the caregivers who are providing family or informal care, how many of those are women by percentage? Miss Jones says 80%. That's a great guess. Miss Shanklin, 75. Mr. Bryan, 92%. Miss Carpenter, 89. And I will continue to let people in and tell you that you were very close. In fact, 71% about of the caregivers who are providing informal and unpaid, even though they may be employed, unpaid care, 71% in our country of those folks are women. And the average caregiver is a 49-year-old woman who works outside the home and then continues to provide up to 20 hours of care per week for her mother. In fact, women spend about 50% more time providing care than do men. And that's a topic I like. Hey, Ms. Turner, how are you? Thank you for speaking to us, and thank you everyone for being here. We enjoy you being here. Today we're going to discuss section 1915C HCBS waiver. And I should say to y'all, I'm a little embarrassed. This is maybe at best a 100 or pre-100 level course. And asking around to folks that I know that do Medicaid processing assistance services, very few, or really none, have done Medicaid waiver applications. Now, I can give you some information, and I'm very proud to say that on many of our classes, we have folks from the area agencies on aging who are present. And if they are on this call today and care to chime in, they can either join us in the chat room, where I hope everyone will add your voice to mine, or they can ask me in a private message to unmute and perhaps correct or elucidate on some of the topics that I'm bringing to you. So you can use the chat room at any time. We encourage it. And I feel very strongly that your voice adds to mine for the entire experience of everyone on this call. And I hope you'll bring your voice to the fore. You can also unmute. We have an evaluation process. Those who've been with us know how it works. It's a Survey Monkey address. And it is, I'll read it to you for those of you who are either on a phone and simply can't see the screen, it's so small, or otherwise working away from your desktop. The evaluation link for today is HTTPS. Thank you, Ms. Tolbert. She always posts that for us. https://www.surveymonkey.com/r/ and all uppercase letters W99V as in victory, H, C as in cat, J. That's our evaluation link for today. It is password protected, and by password protecting it, we can allow our social workers on the line to add this as a live or face-to-face CEU versus a recorded CEU, and that's important. So we'll give the password for this at the end today. Do listen for it. I know some of you will remind me to do so, and I appreciate it when you interact. So we'll give the password later. We'll upload the nursing hours from this evaluation to the ABN website directly within the week, usually on Mondays. And we generally, everyone will get a certificate who completes the evaluation. No one who doesn't complete the evaluation will receive credit. But if you're here just to join us and commune today, we appreciate you for that as well. If you have need of Carepatrol services, aging care navigation services in the Tennessee Valley, look for Dixie Tyler. She serves Florence, Decatur, Huntsville, Madison. Janet Pearson works in Montgomery and Auburn for us. C.W. Merritt and I work in the Birmingham, Tuscaloosa, and Middle Alabama areas, and we're all happy to hear from you. Thank you so much for your referrals. They keep us in business, and we appreciate you so much for that. Our objectives today are threefold, as is our case. Our topic, Section 1915C, HCBS waiver. And we're, as a first objective, going to define, of course, and then discuss, I hope, the basics of the waiver services and to whom these are offered. We're going to, as a second objective, and this will be on the evaluation, list some of the services provided by the HCBS waiver services. I was surprised by some. And then there is list the state of Alabama waiver programs. In other words, what waiver programs that are available or made available by the federal government does Alabama sort of opt into? We'll list those at the conclusion of today. Those are our objectives. We're accredited by the Alabama Board of Nursing and also by the Alabama Board of Social Work Examiners to provide, create, and offer these CEU hours, and we are grateful to them. I know they're very supportive to each of you in your daily work lives. So what is, y'all, and this is a simple question, I bet you all know the answer. What is the 1915C HCBS Medicaid waiver? What is it? What is the 1915C HCBS Medicaid waiver? Well, historically, Medicaid only paid for long-term care in a nursing home. But the 1915C HCBS Medicaid waiver allowed states to then begin to create and offer benefits, Medicaid benefits, to those living outside of institutional care. And HCBS stands for Home and Community-Based Service. And the goal, very simply, is to either delay or prevent institutionalization of folks who require skilled care. Now, it can be provided in someone's home or the home of their relative, or even in some cases in adult foster care or living situations. And waivers are designed by the federal government to target specific groups that are typically at risk of being institutionalized in order to meet their care and safety needs. Now, waivers are not entitlements, and you'll hear me say this again and again. So meeting eligibility criteria does not guarantee that you will receive Medicaid waiver benefits, because there are a limited number of slots. Now, there are broad federal guidelines that look at or instill or install the 1915C waiver services, and states can develop these to meet the needs of long-term care services and supports in homes and in the community at large, rather than in the nursing home setting. Now, in 2009, which was the only data I saw, there were about 1 million folks receiving HCBS waivers in the US, which is, about 1/3%. And nearly all states offer these, including the District of Columbia, and states have the option to operate as many as they wish. So they can create waivers under the guidelines and target specific populations. And currently there are almost 300, over 300, excuse me, HCBS waiver programs in the nation that are active. So state programs then under the federal guideline, thank you, Ms. Bird, for that. She pointed out to y'all, if you didn't see the chat, that HCBS is home and community-based services. And the waiver programs in our state must demonstrate that providing these services won't cost any more than providing those same services in the nursing home, and that they can ensure that by providing these services that people's health and welfare will be held in check, and that there will be adequate and reasonable provider standards for those services providers, and that those services will follow an individualized and person-centered plan of care. So who can get the HCBS waiver? Well, it enables states to tailor, as I said, specific populations. And so it can be specific populations within specific targeted groups that are permitted to establish care. And it may be anything from age or diagnosis, such as someone who maybe has autism or epilepsy, someone who has cerebral palsy or TBI, or even those who have acquired immune deficiency syndrome. Anyone who meets institutionalized care requirements. Ms. Dean, thank you. Answer the question, who can get? Eligible individuals must demonstrate the need for the nursing home or institutional level of care in order to meet eligibility for services not in an institutional setting. And states also are allowed to choose the maximum number of people they serve under the waiver that they set, and they do have to meet financial requirements. You're correct, Ms. Dean. Now, state-defined criteria typically are based on the combination of needs of either acute not either or, acute care medical services like dental or skilled nursing, and then long-term care like respite care or supported employment, or even modifications to one's home. And that's the waiver that falls under this 1915I. Now, what other sections or services might be covered? We've already elucidated one. 1915I is a sort of subset of the waiver set. Are there any others that you're familiar with that you've worked with? No, none of you have worked with the aging in this population. States can waive certain Medicaid programs under the HCBS waivers. There's a state wideness provision that allows states under section 1902A to direct waivers to certain targeted areas within the state. So where the need is greatest, for example, this would be a rural area. You might think of the Black Belt in Alabama as being a state wideness type of waiver. There's the comparability of services, which is further in section 1902A, that lets states make waivers only to certain groups who are at risk of institutionalization. So the elderly, for example, or technology-dependent children, people with behavioral conditions. I'd love to see more of this in the state of Alabama, or people with intellectual disabilities, of which there's a broad network of support for this population, thank goodness, although not broad enough. And then there is the income and resource rules that are applicable to the community. So states can, under this provision, provide Medicaid to people who wouldn't otherwise qualify financially because of the income of a spouse or parent to whom they or on whom they were dependent. Now, 1959, which we sort of brushed across a minute ago, allows states to develop home care-based services and benefits to meet specific populations, but they have to follow this course of action. One is that they have to ensure that the process allows for unbiased and independent evaluations of the prospective beneficiary. And it must ensure that the benefit is available to all eligible individuals across the state, must provide adequate and reasonable provider standards to meet this population, and ensure that the home care-based services are provided with a person-centered service plan that allows for and ensures quality assurance, monitoring, and improvement strategies as we go along in delivering the benefit. The states can choose to opt out of some of the conditions that the federal government set, such as, and this is under comparability of services, again, 1902A, states can make 1915I services available to elderly or disabled individuals with specific needs and risk factors. For example, again, targeted technology-dependent children or services for someone with AIDS. Now, this is not something we see in Alabama. Income and resource rules applicable. I think I've already did this. Somehow I've gotten two slides together, y'all. I apologize. I will say this topic really got the best of me. It's self-directed PAS services, which is in section 1915J, self-directed personal assistance services, or PAS, are personal care and related services provided under 1915C waivers that the state would already have in place. So participation is open to everyone who's receiving the benefit, and yet it's voluntary. So you do not have to assume a self-directed plan. And if you do, those who do set their own provider qualifications and train their own providers, which would mean, for example, that it would open the pool of providers to the person. And then the participant determines how much they would pay for the service they now both installed, trained, and are now paying. So they would determine how much they pay, they would train, they would determine what they're doing, and they would do so in tandem with a Medicaid officer. Now, this is a very similar program to something I did some years ago, or attempted to do with the VA, the veterans, in that they were looking to have what are called medical foster homes set up, in which case a veteran would go and live with a family who volunteers their home to this case. The veteran would receive the medical services from the VA, but they would contract with the homeowner, for whatever they elected to pay, and the homeowner agreed. So it was an idea that was supposed to bring veterans who were isolated into community again. And I thought it was a terrific idea. It was being trialed in certain areas. I don't think it took off here in Alabama, unfortunately, but it was a similar service to this 1915J. And so we see the federal government making these things available. Here's someone to come in, Ms. Hinton. So states can already target under 1915J people already getting 1915C waiver. And they can also, under the provision, limit the number who are allowed to direct their PAS and limit the self-direction option to certain areas of the state, or either offer it statewide. Now, at the state's option, people enrolled in the 1915J can hire legally liable relatives, such as parents or spouses, manage a cash disbursement, so they would be paid and then pay the provider, purchase good support services or supplies that would help them maintain their independence and safety. And the sort of catch to that is that the cost of those supplies or services can't be greater than something they would pay for human help. And then they even have a discretionary amount in their budget to purchase things not listed on the budget, so long as those are permissible. And again, and because I so like this section, 1915J, there's a service plan, obviously, and budget using a person-centered plan, as we said before. Participants can engage in and direct this process from the start and choose family, friends, and others, including professionals, to be involved. These participants can then name their preferences and choices, their abilities and disabilities, their needs, and what will be in their best interest, unlike an institutional setting. And the plan must also include a contingency plan, a plan B, in the event that things don't go as well as planned, and then also a risk adjustment plan in case things really go haywire. Now, the community first choice, which is a obviously CFC under section 1915K, allows states to provide home and community-based attendance services and supports Medicaid enrollees. This was established under the Affordable Care Act in 2010 and became available in 2011, but yet only 6 states have participated in this, and those are California, Maryland, Montana, Oregon, and Texas. Alabama does not participate in the matching plan with the federal government. So can individuals receive compensation for administering the waiver? In other words, could the parent or spouse be paid? And I think we've already answered that, but I find it interesting that it works that way. I mean, you understand, y'all, we have a very serious shortage of caregivers in the United States. You know that 10,000 people are turning 65 today, and 10,000 people turned 65 yesterday, and 10,000 people turned 65 a year ago today, and 10,000 people turned 65 14 years ago today. And this will happen every day until December 31st of 2024. I'm way off centuries for y'all, I apologize. So until 2024, 10,000 people turn 65 every day. And right now, about 40% of Americans are caregivers, 70% of those are women. where is the care coming from? You all know in your own lives and in your own workplaces that we have staffing shortages. And so these waiver programs that allow us to incorporate loved ones and family members as well as professional caregivers, I think, is one way that we can solve this issue in our nation and in our state. And so not only can we pay for care, at least we could, if we could pass the Credit for Caring Act, we could even provide greater ability for people to get a tax credit in the event that they're caring for caregivers. Now, like everything in Congress, this is stalled right now, but if it is passed, there would be a 30% credit for caregivers who work, who have expenses over $2,000 annually to provide care. And this would allow them to spend that money, in a sense, on aids to replace themselves, or adult daycare to replace themselves, or home modifications to make this easier. The bill has widespread support, and the AARP says that this legislation, if passed, could grow the gross domestic product by $1.7 trillion. This is needed. Ms. Talbert says, most of our calls and requests for waiver services are for spouses who want to get paid for caring for their spouse. We also receive a large amount of calls from parents who want to get paid to take care of their children. And I'm so glad you brought this up, Ms. Talbert. So you get these calls, and what do you do with these calls? Do you have a resource that you could offer us or others? Do you have experience that would trump mine for sure? And I'll give you some time to think as we go along, but I'd love to hear more if you're so kind. So what services then, y'all, does the state of Alabama provide under their options as the federal government has laid out through 1915C and all of the parts that we've discussed, JK and I and others that follow it? What services does the state of Alabama provide under Section 1915C of the HCBS waiver? And Ms. Dean says, as a member of the ADRC, we conduct an intake assessment and make the required referrals. Thanks, Darla, my co-worker. Oh, I didn't know y'all worked together. How nice. Thank you. You know, you're very often here, Ms. Dean and Ms. Talbert. You work together, and I appreciate you so much for being here and so much for what you do. So I'll keep asking because I'm enjoying this. I hope everyone else is. And so when you make the requested or required referral, to whom are you making that referral? And what services does Alabama provide when you make that referral? Well, the federal government lays out that the state can target the HCBS benefit to one or more specific populations, and it can establish separate additional needs-based criteria above those laid out by the federal government. It can establish a new Medicaid eligibility group, even for people to get a state plan, and it can define the services that are included in the benefit as it's laid out, including CMS approved, quote, other services that are applicable to that identified population. And again, there is an option, although it is limited, to allow these to be self-directed. Does Alabama pay relative caregivers? ADRC, Aging and Disability Resource Center, is where Ms. Dean sends her referrals. That's one place. And yes, if the patient is eligible for the Medicaid waiver program, Alabama will pay for relative caregivers. And Ms. Talbert agrees. Thank y'all. I thought that was the case, but I couldn't tell. You know, if you read, and y'all know this, but if you read Medicaid, which I've done a good bit of, you really kind of have to pull out what they're trying to say. And I never could pull out, quite honestly, whether we can do that. Ms. Jones, you're right. They're intentionally vague. That's why I hope that there would be folks like Ms. Talbert and Ms. Dean here to correct me and add to your knowledge, which is the point. So what Alabama offers under 1915C is called the Alabama Home and Community-Based Elderly and Disability Waiver, or the E&D waiver. It is a 1915C Medicaid waiver, HCBS, and it's for the elderly and the disabled Alabama residents at risk of being placed in a nursing home. And Ms. Talbert says the person who wants to get paid cannot have a criminal history. Taxes are deducted from the employee's pay. Yes, I did find that out. And so benefits can vary based on the needs of the participant, as one might guess. For an example, if someone was living alone and received HCBS waiver, they might receive some in-home personal care assistance or homemaker services as part of that award, whereas someone who was living with a family caregiver would perhaps have a different set of benefits, like the option to pay for adult day health care to relieve the family caregiver, or respite care to relieve the family caregiver. And so that's part of Alabama's 1915C waiver, or the E&D waiver. It can be provided by licensed care workers, but it can be self-directed via the Personal Choices program, which is Alabama's nomenclature for that. It allows for the hiring of a relative or friend to provide care, as Ms. Talbert and Ms. Dean confirmed. It allows for the financial agency who handles this for them to essentially pay background check and pay taxes, as Ms. Talbert just pointed out. And the persons who are qualified in Alabama to be paid under this E&D waiver are sons and daughters, children, obviously, adult grandchildren, nieces, nephews, and in some cases, spouses, though not all. Certainly, if we found a fairly aged couple and both spouses were in need of assistance, we wouldn't set one up as the caregiver for the other in that instance. So the E&D waiver in Alabama pays for respite care. Now, this can be someone staying with you while family members are away on errands, or it could be a placement into a community on a temporary basis while your family caregivers are out of town. The E&D waiver provides case management by a social worker who will help the individual decide what they need in the way of services. They'll handle the problems and the installation of those services and I'm sure this is what Ms. Dean and Talbert do all day, every day, and inform the resources about new options that may be help keep them independent and safe. Now, E&D also pays for adult day. These are centers, freestanding, generally, well, within churches most often, centers that provide activities, at least one meal, sometimes two, and community socialization, opportunity to do things, to keep the mind plastic. And these can be done at a 4-hour minimum. So you could go morning and afternoon, or just morning. You could go every day or just once a week. And transportation is provided under the waiver for the beneficiary to get to and from daycare. The E&D waiver provides a meals program. These may be frozen, they may be shelf stable, or they may be freshly made. And then there are skilled nursing visits that are part of the waiver, so an RN, LPN, and supervisory visits by someone within the Medicaid structure. Ms. Dean says no services are provided if the client enters the hospital or SNF. That's an important point. Thank you for letting us know that. And then there are adult companion services. So there are really sort of three pieces to the waiver. that would run through an in-home care provider. And that would be adult companion, which is just that, maybe some light assistance with activities of daily living, but nothing egregious. And then there's the personal care component as defined by Alabama, which would be things like bathing, shaving, dressing, hygiene. This would be not medical in any way. And then there would be homemaker services, again, offered through an in-home care entity in which you might have someone do your laundry or clean or cook some meals in advance for you. They also offer pest control services, which can be very valuable in some cases, as I'm sure you can imagine, and vehicle modifications, as well as home modifications are allowed. So let's say that you're someone who is recently become confined to a wheelchair. Through this benefit, you could have the doors widened in your home so that you could more effectively pass through. The counters changed so that you could wheel under and use the counters and the sink and things, or have a roll-in shower installed. So all of these things would be available through the E&D waiver. And to Ms. Talbert's point, or Ms. Dean's point, workman's comp makes some of these same things available. And then there's assistive technology, not to be confused with other technologies, but assistive technology would be more like DME products. Now, the elderly and or the disabled may apply for the E&D waiver in Alabama. The financial eligibility is the same for Medicaid services across the nation, and that is that the income monthly must be below $2,742 per month, which is 300%. This is how it's calculated, this dollar amount, 300% of the federal benefit rate. Now, in Alabama, the maximum amount of income that can be transferred to a non-applicant spouse is $2,465 per month. In other words, if you, as a married couple, had an income of $5,000 monthly, your spouse could only keep $2,465, and you would, or Medicaid in this case, would lay claim to $2,535. Now, there is a spousal allowance, which is designed to keep the non-community spouse from impoverishment. And this also applies in the E&D waiver situation. The non-applicant spouse can keep 50% of the marital asset, which is up to $148,620. Now, if they have under $29,724, they keep all of that. And what does that tell you? It tells you that in between it's spent somehow. The applicant's resource limit is $2,000. That's their asset limit. And that is every first day of every month, they must comply and qualify with having less than $2,000 in assets. And if the applicant is in their home and intends to, or is able to receive E&D services, the equity in that home into which they return or remain cannot be any greater than $688,000. I think that assures that most people would not be affected in the state. Certainly I wouldn't. Now, Ms. Fuqua asked, if applicants seeking compensation, does that include misdemeanors too? And Ms. Dean said basically anything more than a minor traffic violation is prohibitive. Drugs, DV, or other felony charges disqualify the applicant. I mean, that seems intentional, I'll say, and leave it at that. In the state of Alabama, who can provide Section 1915C HCBS waiver services? Or maybe a better way to ask that is, how do you get them? Who do you call? How is it achieved? And Ms. Dean said, we want to ensure the safety and welfare of the client receiving services. And I agree with that. But I really do think in many ways that drug policy and law is intentional. I think that those who are caught in it are disenfranchised, and the intent is to keep them disenfranchised by not allowing them to vote, by sending them to prison. To me, and I understand that there is a drug problem, don't get me wrong, I know it is, but I feel like there are certain populations, certainly those that are already under, resourced and underutilized, already are at a disadvantage. And so then to remove from that population their forebears, their grandparents and parents, to remove them from the ability to help them, to me, is just another unnecessary penalty. But that's me. Now, with the E&D waiver, services can be provided at home. That can be provided in an adult foster home, provided that it only serves one participant. They cannot live in group homes that are foster homes, nor in assisted living. Now, the E&D waiver is not, again, an entitlement program, because meeting eligibility doesn't mean you will get the benefits immediately or ever. There are a limited number of slots, and when the slots are full, the waiting list forms. And I expect that most any of you who have sought Medicaid waiver services from any area agency on aging that administers those have probably found that there simply aren't enough agencies available willing to provide those services. And again, I think if we remove the ability for the family member to do so, then who's going to care for these folks? That's my concern. How do we care for people if we begin to place boxes on who they might have been 20 years ago? And now also, among the availability of slots, a certain number is held every year by the state for people who are currently in an institution but would like to transition back to the community, back to their home or a residence of someone else. Now, to apply for E&D waiver services in Alabama, we would look for Form 204-205. Ms. Dean says that is called Gateway to Community Waiver. Thank you. Ms. Dean, you need to give the next one of these. I'm going to hold you to that. Completed applications will be mailed to either your district Medicaid office, or you can also contact your area agency on aging. In Birmingham, that would be the United Way. And the applicants would then be contacted upon the receipt of the application by the Medicaid caseworker to begin the case. Now, the area agencies on aging, I'm listing numbers here for you all. And for those who cannot see the screen, the AAA in Alabama can be reached, Area Agency on Aging, through 877-425-2243 or 800-243-5463. Now, those of you who have been with me before know that I give these presentations to you. So I probably won't read all the numbers or addresses, but they'll be there for you, and you can use them anytime. Now, there is in Alabama, the Medicaid Agency and Department of Senior Services, ADSS, administer the E&D Medicaid waiver. The Personal Choices Plan option is administered by Medicaid, ADSS, and the Alabama Department of Rehabilitation Services. And again, E&D is not entitlement. There is a waiting list, and it's only approved for a maximum of 9,355 beneficiaries per year. So we have about, I guess, 3.5, a little over a million people in the state. I mean, that's basically 10,000. That's a small percentage. And in case of the wait list, just so you know, you may have a client who applies today who is passed over for services by a client who applies 6 months from today, because their needs may be deemed as greater than yours. Ashley Talbert is saying, when people mail them to the Alabama Medicaid District Office in Mobile, they are rejected. The district office refers applicants to contact us, the area agency on aging. Thank you. I didn't know that's where you were. Thank you. I love AAAs. I mean, they're so necessary. And of course, it's a federal benefit. Ms. Smith says, we use our local area on aging and have good success in the nursing home I work in. Great program. Thank you for saying that for those folks, Ms. Smith. Now, in the assessment for determining if someone meets the E&D waiver, they have to be either disabled and or meet the nursing home level of care. And the tool that Alabama recommends for this is the Alabama Home and Community-Based Services Program Assessment, or HCBS-1 form. Now, from a list of 11 criteria, the applicant must meet 2 of the 11. One that's commonly met is the need for the assistance with at least one ADL, and the other that can be relevant and not necessarily related to an ADL could be the presence of Alzheimer's or some other related dementia or behavioral problems such as schizophrenia might also be considered. And here we would contact the Alabama Department of Senior Services to understand more. And then we want to talk about sales services in Alabama. These are popular, and I'm sure that there are those of you who work with those as well. To receive SAIL, which stands for the state of Alabama, independent, what is the L for, y'all? Living waiver. You got to be 18. And you have to meet the criteria for coverage, Medicaid coverage in a nursing home, but yet you prefer to not be in a nursing home. You want to remain at home. So specific medical diagnoses have been set aside by the state of Alabama as qualifying for the SAIL program. These include quadriplegia, TBI, ALS, MS, spinal muscular atrophy, muscular dystrophy, severe cerebral palsy, stroke, and other neurological impairments, and any severely debilitating disease or rare genetic disease. And the services that are available are, as before, case management, personal care, environmental accessibility adaptations, in other words, home modifications, personal emergency response system, not only the installation of these, but the monthly installment or monthly subscription, medical supplies, including at DME, and then minor assistive technology, repairs, and evaluations. So the functioning of a service of an OT to help you, choose the height of your walker, for example, and personal assistance services. Now, the contact for SAIL is the Alabama Department of Rehabilitation Services, ADRS. The number is on the screen, and you'll receive it when you receive the presentation. And Ms. Dean says it's important to remember that any MCD application must be attached to an MCD waiver program. That's interesting. That would make perfect sense. So there is also in Alabama something we call the Alabama Community Transition Waiver, or ACT. And this is something that assists nursing home residents to transition back to a home, their home, or someone else's. And they must require, as in all cases above, a nursing level of care, and they must have been in the institution for at least 90 days or expected to move into an institution within 180 days. And there are 200 slots available only. The benefits would include home modifications, respite care, PERS, companionship, and adult daycare, as well as up to $20,000 in assistive technology if it's deemed to be medically necessary. Now, PACE is something that I remember being introduced back around 2005 or 6, maybe 7, and it includes the benefits of Medicaid and Medicare combined into one. This is sometimes known as a dual eligible, and it might allow for additional benefits such as dental care, eye care. It is generally as for someone only who is already fully enrolled in Medicaid or one of Medicaid's savings programs. Now, it covers physician visits, hospital services, inpatient and out, lab services and x-rays. It also pays nursing home care and limited personal care assistance in one's home. Alabama offers these via the 1915C waiver program, but only in Mobile and Baldwin counties. Is anyone on the call from those counties? Perhaps you have experience with the PACE program. Please note the AAA in Mobile is not a PACE provider, but can make the referral. Ms. Deans, thank you. I swear, I really, you're laughing, but I'm going to have you do this soon for me. And that's it for today, y'all. I ran a little short and I do apologize. This was a tough topic for me. And clearly I don't know nearly as much as our own, as our attendees. So thank you for being present with us. Our code word today is no spaces, E and D. Now the and in E and D is the ampersand sign, which looks a little bit like a backward S or 8. So E and D, all caps, is our code word. Our survey, thank you, Ms. Talbert and Ms. Jones. Ashley and I are in the Mobile, Baldwin, and Escambia counties. Oh, neat. I'll be down there soon. https://www.surveymonkey.com/r/all uppercase letters W9 V is in Victory, H, C is in cat, J. So the Survey Monkey, the last digits are all caps W99VHCJ. Please, if you can, get these done by 8 o'clock tonight. That allows me to get certificates out to you first thing in the morning. You should all who do an evaluation receive a certificate, excuse me, within 24 hours. Nurses, it may be Monday of next week before we load your hours to the ABN, but we will get it done. And social workers, you're allowed to post your own. If anyone needs recorded CEUs, is up for renewal and needs to get some done, you can go to YouTube and Google Sean Barnes Carepatrol. We have about 75 or so recorded there for your use. Those are free like this one. And we appreciate you as always. Thank you for your referrals. Thank you for commenting today and for coming today. And I do want to say for some of you, I have an apology, which is, I am completely unaware of holidays. This always gets me in trouble at my anniversary and sometimes Easter and Christmas. But I have scheduled a CEU for the 19th, which is Juneteenth. And this is something that has been happening for 157 years in this country. Juneteenth is on Monday, and we'll return with the CEU. Those of you that are honoring June 19th, it's a federal holiday. If you are so willing, please join us. If it is upsetting to you that we've scheduled something on a holiday, I apologize. Let's see. I'm looking for comments here. I want to make sure I didn't leave anything out. And Ms. Fuqua says she'd love to hear more about the Area Agency on Aging. Ms. Dean, are you listening, Ms. Talbert? And how it can help homebound patients. I work in Mobile County as well. Well, yes, you need to call Ms. Dean and Ms. Talbert. And Ashley Talbert has placed in the chat our link again. It is a complicated subject, E and D. Thank you, Ms. Talbert. For the applicant, are there any exceptions allowed? I know in Tennessee, the applicant can sign a document because they know they have something on their record. And of course, the employer is aware, but wants the person to work for the participant. I am unable to answer at this time. We'll gladly reach. Thank you, Ms. Dean. I'd love to know the answer too. Maybe when I send out the certificates, Ms. Dean could, if you know the answer by then, you could let us know about Alabama or Tennessee and whether we can actually have folks who can sign a waiver. And Ms. Dean says that you can call them about the PACE program in Mobile and Baldwin County at 251-706-4680. And I thank you all again. Thank you for being here today. That was just really, really great that you were here today and could share your information. It's what I mean when I say that your voice adds to mine and makes for a much greater experience than I alone can provide. We are all better off working together with other people than we are trying to go it alone. Thank you all for being with us. Join us Friday. We will have Jessica Friedman of the Friedman Law Firm, who's going to discuss with us some challenges of working with veterans. And I think that'll be also interesting. I hope you'll be with us then. And you can always reach us at the numbers here on the screen. If you have a referral, ask them if they'll let you give us their name and number. We'll call them, take that stressor off of them as well. Y'all have a great week, and thank you for being here.